Hey everybody, I hope you're having a good day so far. In this video, I want to cover the VAERS Vaccine Adverse Event Reporting System. And I want to go through all 140 plus deaths that have been added in there that could possibly be related to the vaccines. I'm not making any claims that they are. Somebody felt like there might be a connection and reported it to the passive reporting system called VAERS. Let me show you what VAERS looks like here. It's vaers.hhs.gov. So for YouTube, don't delete this video. This is straight up from the HHS. And I'm trying to educate the people because informed consent is a very important thing. And all of these people who died, I'm so sorry for their family. And my condolences to everybody. And it took me a while to put this video together. So if you like the work and you want to see more videos like this to keep on top of the VAERS data, the best way you can support this channel is GroupDiscover.com. GroupDiscover.com, and the coupon code to save 40% is no forced meds. All lowercase, one word. No forced meds. So let's dive right in here. So I put together a slideshow with a slide for every record in the database, every death record. And I wanted to go through this, and I wanted to give each person some airtime. I want to go through each person's story, and these are only United States deaths. We also had some other stories about, I believe, Norway, 23 people dying in close proximity to their vaccine, and then in Germany, 10 people dying. So I just wanted to go through this, and I think it'll be very interesting to see whether YouTube leaves this up or whether they strike me and take it down. I'm just trying to pay homage to those who have passed. So without further ado, let's dive right in. The first person here, patient received vaccine on 1/4/2021. He was in hospice for CHF and renal failure, but was able to get up in his wheelchair and eat and take medications and talk. On 1/5/2021 a.m., he was noted to be very lethargic and could only mumble, could not swallow. No localizing neurological findings. He was too lethargic to get up in chair. So you can see for each one of these slides, we have the description they typed in. These are only people in the VAERS database who died, and they were the people who got the COVID vaccine. And at the bottom here, you can see the report number. So you can verify this yourself. You can go and download their data and check my work. And if I made any mistake, please let me know. I apologize, but I did my best to make this accurate. And you can also see their gender and age. So this is an 86-year-old male. You can see the vax date, and some of these will have their reported on date as well. So let's go to the next one here. On 12/24, the resident was sleepy and stayed in bed most of the shift. Now keep in mind, you can see down here, the vax date was 12/23, so the day before. So on 12/24, the resident was sleepy and stayed in bed most of the shift. He stated he was doing okay, but requested pain medication for his legs at 2:50 p.m. At 2:55 a.m. on 12/25/2020, the resident was observed in bed lying still, pale, eyes half open, and foam coming from mouth and unresponsive. He was not breathing and with no pulse. So that escalated quickly from 12/23, and we see that's a 66-year-old male. Rest in peace. The next death we have here, patient had mild hypotension, decreased oral intake, somnolence starting 3 days after vaccination, and death 5 days after administration. He did have advanced dementia and was hospice eligible based on history of aspiration pneumonia. Next, we have an 84-year-old female, vaccine administered with no immediate adverse reaction at 12:29 a.m. Vaccine screening questions were completed and resident was not feeling sick and temperature was 98 degrees Fahrenheit. At approximately 1:30 p.m., the resident passed away. Wow, I guess it's on the same day. 2 hours apart. Wow. 2 hours after the vax. Next, looks like a grandson or granddaughter filing a report for their grandmother. They say, my grandmother died a few hours after receiving the Moderna COVID vaccine booster 1. While I don't expect that the events are related, the treating hospital did not acknowledge this, and I wanted to make sure a report was made. I wonder how many other reports slipped through the cracks and never were filed. This is a 74-year-old male. Spouse awoke 12:20 and found spouse dead. It says down here the vax date was 4 days earlier, 12/16. Client was not transferred to hospital. Next is an 89-year-old female. A resident in our long-term care facility who received first dose of Moderna COVID-19 vaccine on 12/22/2020. Only documented side effect was mild fatigue after receiving. She passed away on 12/27/2020 of natural causes per report. Has previously been in and out of hospice care. Resided in nursing home for 9+ years. Elderly with dementia. Due to proximity of vaccination, we felt we should report the death, even though it is not believed to be related. Next is an 83-year-old female. Within 24 hours of receiving the vaccine, fever and respiratory distress and anxiety developed requiring oxygen, morphine, and Ativan. My mom passed away on the evening of 12/26/2020. The vax was on 12/23. The next one is short. It just says resident coded and expired. I presumably right after the vaccine. I don't know. It's just very ambiguous as to what happened there. Next up, we have a 78-year-old male. Injection given on 12/28. No adverse events and no issues yesterday. Death today. 12:30 at approximately 2 a.m. Unknown if related. Administrator marked as natural causes. Next, death by massive heart attack. Pfizer BioNTech COVID-19 vaccine EUA. Massive heart attack, death. Next, patient passed away with an hour to hour and half of receiving vaccine. With an hour to an hour and a half of receiving vaccine. Per nursing home staff, they did not expect patient to make it many more days. Patient was unresponsive in a room when shot was given. Next, patient was a nursing home patient. Patient received first dose of COVID vaccine. Patient was monitored for 15 minutes after getting shot. Staff reported that patient was 15 days post-COVID. Patient passed away within 90 minutes of getting the vaccine. Patient passed away within 90 minutes of getting the vaccine. Next is an 88-year-old female. Patient received vaccine at COVID clinic on 12/30. At approximately 3:30, vomited 4 minutes after receiving shot. Dark brown vomit. Staff reported patient had vomited night before. Per staff report, patient became short of breath between 6 and 7 p.m. that night. Patient had do not resuscitate on file. Patient passed away at approximately 10 p.m. Staff reported patient was 14+ days post-COVID. Resident received vaccine per pharmacy at the facility at 5 p.m. Approximately 6:45, resident found unresponsive. So that's an hour and 45 minutes later. Resident found unresponsive and EMS contacted. Upon EMS arrival at facility, resident went into cardiac arrest. Code initiated by EMS and transported to hospital. Resident expired at hospital at approximately 8 p.m. 85-year-old female. Next, we have a 99-year-old male. Patient died within 12 hours of receiving the vaccine. 12 hours. Next, resident received vaccine in AM and expired that afternoon. Next, after vaccination, patient tested positive for COVID-19. Patient was very ill and had numerous chronic health issues prior to vaccination. Facility had a number of patients who had already tested positive for COVID-19. vaccination continued in an effort to prevent the patient from contracting the virus or to mitigate his risk. This was unsuccessful and patient died. Well, rest in peace to him. Next, we have a 90-year-old female patient. At the time of vaccination, there was an outbreak of residents who had already tested positive for COVID-19 at the nursing home where patient was a resident. About a week later, patient tested positive for COVID-19. She had a number of chronic underlying health conditions. Did they copy and paste the same report? The vaccine did not have enough time to prevent COVID-19. There is no evidence that the vaccination caused patient's death. It simply didn't have time to save her life. That's their opinion. Next, we have a 78-year-old female. Prior to the administration of the COVID-19 vaccine. Let me start again. Prior to the administration of the COVID-19 vaccine, the nursing home had an outbreak of COVID-19. Patient was vaccinated, and around a week later, she tested positive for COVID-19. She had underlying thyroid and diabetes disease. She died as a result of COVID-19 and her underlying health conditions, and not as a result of the vaccine, says the report. Next, we have somebody who was vaccinated on 12/30, died on 1/1 of the next, I guess it's supposed to mean 2021, right? 1/1, residents was found unresponsive, pronounced deceased at 6:02 p.m. Next, we have a resident found unresponsive without pulse, respirations at 4:30, CPR performed, expired at 4:52 by rescue. That's a 65-year-old female. Next, resident became short of breath, congested, and hypoxic, requiring oxygen. Respiratory treatments and suctioning. Stabilized after treatment, and for the next 72 hours with oxygen saturations in the 90s. On 1/3/2021, was found without a pulse and respirations. Resident was a do not resuscitate on hospice. The next report says 2 days post-vaccine, patient went into cardiac arrest and passed away, 94-year-old male. 2 days after. Next, we have syncopal episode, arrested, CPR, and death. 50-year-old female. And again, for all these, you can see the VAERS report ID number, so you can confirm that this is in fact HHS data. And I'm hoping the YouTube censors won't delete this. And by the way, feel free to upload this video on your own channel if you want to get the word out. Just download it, upload it. If you go to library, it should make it really easy to download the MP4 file. So next up, we have a female, 100 years old, fever, malaise, and death. I don't know why it doesn't mention the death. They just checked that box and didn't include it in the description. Next, we have a 96-year-old female. Resident exhibited no adverse events during 30-minute monitoring following vaccine administration. Resident found without a pulse at 7:00 p.m. Redness and warmth with edema to right side of neck and under chin. Resident was on hospice services and expired on 1/1/21. Vaxxed on 12/29/2020. This is a long one. I should have made the text bigger. Resident noted to have some redness in face and respirations were fast. Resident vital signs were abnormal except blood pressure. Temp at the time was 102 degrees Fahrenheit, taken temporal. Resident respirations were 12, labored at times. Pulse is 105, and pulse ox 94% on room air. Resident is made comfortable in bed. Notified triage of change in condition. Also made triage aware of resident receiving COVID vaccination yesterday morning. Resident's appetite and fluid consumption has been poor for a few days. 12/30/2020, 7:32 a.m. Received order from agency to administer acetaminophen, 650 milligram suppository rectally due to resident not wanting to swallow anything, including fluids, medications, and food. This writer administered medication as NP ordered. Will monitor for effectiveness and adverse effects, if any. On 12/30/2020, they write, at 8:41 a.m., received new orders to obtain flu swab, obtain CBC and BMP, and chest x-ray, all to be ordered today. Notified family of resident having temperature and vital signs excluding blood pressure that was abnormal. Family was thankful for call. Educated the family on benefits of hospice services, but family will accommodate resident family to be able to be bedside when time comes to do so. NP ordered IVF and IV Levaquin on 12/31/20. Family chose at that time to sign for hospice services and not have resident provided with IVF or IV antibiotics. So that one's kind of confusing to me. All right, so the next of the 148 HHS listed people who died in close proximity to getting the COVID vaccine is a 93-year-old male. Here's his information. The resident received his vaccine around 11 a.m. and tolerated it without any difficulty or immediate adverse effects. He was at therapy from 12:36 p.m. until 1:22 p.m. when he stated he was too tired and could not do anymore. The therapist took him back to his room, and at that time he got into bed himself, but stated his legs felt heavy. At 1:50 p.m., the CNA answered the call light and found he had taken himself to the bathroom. She stated that when he went to get back into the bed, it was abnormal how he was getting into it, so she assisted him. At that time, he quit breathing, and she called a registered nurse into the room immediately. He was found without a pulse, respiration, or blood pressure at 1:54 p.m. He was a do not resuscitate. Found deceased in her home, unknown cause, 6 days after vaccine. Vaccine on 12/30/2020. Screening PCR done 12/31/2020. Symptoms 1/1/2020. 1. COVID test result came back positive. 1/2/2021. Deceased 1/4/2021. That's a 104-year-old female. Next, a 77-year-old female. Resident received COVID vaccine. Noted after 30 minutes with labored breathing. These vitals, I'm not sure. Heart rate 116 is really high, I know. I don't know about these other ones. And of course, she died because she's on this list. Next, vaccine given on 12/29/2020 by pharmacy. On 1/1/2021, resident became lethargic and sluggish and developed a rash on forearms. He was a hospice recipient and doctor, and hospice ordered no treatment, just to continue to monitor. When no improvement of condition reported, doctor and hospice ordered comfort meds, morphine, Ativan, Levsin. Resident expired on 1/4/2021. That's an 88-year-old male. Next, we have death on 1/4/2021. Resident received vaccine on 1/2/2020. I guess they meant 21. 2 days after the vaccine, unless somehow they scored it last year, which would be impossible, right? That was a 65-year-old man. Next is an 87-year-old man. Resident had body aches, a low O2 saturation, and had chills starting on 12/30/2020. He had stated that they had slightly improved. On 1/1/2021, he sustained a fall with the diagnosis of a displaced hip fracture. On 1/2/2021, during the NOC shift, his O2 saturation dropped again. He later went unresponsive and passed away. So just a few days after his vaccination. Next, we have LTCF Pfizer vaccine clinic conducted 12/29 vaccine lead received a call indicating that a staff member deceased somewhere between 1/3 and 1/4. Cause of death is unknown, and an autopsy is being performed. Next, a vaccine received at about 9 a.m. on 1/4/2021 at her place of work, the medical center, where she was employed as a housekeeper. About 1 hour after receiving the vaccine, she experienced a hot flash. nausea, and feeling like she was going to pass out after she had bent down. Later, at about 1500 hours, it's 3 p.m., she appeared tired and lethargic. Then a short time later, at 4 p.m., upon arrival to a friend's home, she complained of feeling hot and having difficulty breathing. She then collapsed. Then when medics arrived, she was still breathing slowly, then went into cardiac arrest and was unable to be revived. That's a 58-year-old female. Same day of her shot. Just in the afternoon. Next, we have the resident was found deceased a little less than 12 hours following COVID vaccination, and he had had some changes over the last 2 days. He was 96 and had been on hospice care for a little while. No one noticed any side effects from vaccine after it was given. Next, we have somebody else dying, and it tells us they were COVID positive and on remdesivir. Next, we have a 62-year-old male patient, was vaccinated December 30th, 2020, prime dose of Moderna vaccine, observed for full 15 minutes post-injection, no complaints when asked during observation, released. Subsequently, vaccine clinic staff learned from the patient's supervisor that on January 4th, that the patient had expired on January 2nd. Okay, that's a little bit confusing. So he was vaccinated on December 30th and he died on January 2nd. By report from the supervisor, the patient was found dead at his home. The patient's primary care provider was unaware of his death when contacted by this reporter today. Next, we have an 84-year-old female patient. All it says in the report, resident expired 1/1/2021. That means dead. Next, we have a 91-year-old female. I don't know. I'm guessing the same person filled this form out. It says resident expired 1/3/2021. And let's look at the dates on these going back. This is the day, well, maybe 2 days after. So they got the vax on 12/30. They died on January 1st. This person got it also on 12/30, but died a few days after on January the 3rd. Here's a longer description for this 85-year-old female patient who's deceased. Patient did not display any obvious signs or symptoms. The vaccination was administered at approximately at approximately 10 a.m., and the patient continued throughout the day without any complaints or signs of adverse reaction. Patient was helped to bed by the nursing assistant, estimated at around 9 p.m. The facility received a notification from the lab around 11 p.m. that the patient's COVID-19 specimen collection from Sunday 1/3/2021 detected COVID-19. When the nursing staff went to the room to check on the resident and prepare her to move to a COVID-19 care area, the patient was found unresponsive, no movement, no chest rises, noted regurgitation noted regurgitated small amounts of food to mouth left side, lying on left side, pupils non-reactive, and dead, apparently. So they got the vax in that case on 1/5, died. I'm not sure. Maybe the same day. It's a little ambiguous there. Next, we have a 61-year-old female. Coughing up blood, significant hemoptysis. Cardiac arrest started day after vaccine, but likely related to ongoing progression of lung cancer, they think. Here's a 92-year-old female patient. At approximately 18:55, that's 6:55 p.m., I was alerted by caregiver. Resident was not responding. Per caregiver, she was doing her rounds and found resident in bed, unresponsive, mouth open, observed gurgling noises and tongue hanging out of mouth. This primary caregiver observed resident at baseline and ambulating after dinner at approximately 6 p.m., less than an hour prior to incident. This PCG called 911 for EMS and gave report of incident. Resident was taken to medical center emergency department. At the ER, CT scan and X-ray was performed. Per report from ER RN, CT scan and X-ray revealed an intracranial aneurysm and fluid in the lungs. Per RN, resident was still unresponsive and was admitted to medical center for observation and comfort measures. This primary caregiver reported to registered nurse, resident recently received the first dose of COVID-19 vaccine on 1/2. Primary caregiver received a call from Castle RN at 7 a.m. Resident expired at 6:15 a.m. So I'm trying to think, how long was it between the shot and the passing? I can't really tell. This report just says deceased for this 84-year-old female. Where's the care? Can you give us what happened? She was vaccinated on 1/3. That's all we know, and she died. This person, 77-year-old male, patient was found deceased in his home on 1/5. He was vaxxed on 12/31. This person, an 81-year-old male, expired on 1/5/2021, vaxxed on 12/30. This is a 74-year-old male. Patient last seen at 12 o'clock by nurse for ID band check. No visible signs of distress noted. Patient states, I just want to be left alone. At 12:30, nurse was called to patient room. Patient was noted unresponsive. No pulse and respiration noted. CPR started immediately. At 12:39, first shock given. 12:46, EMT took over. At 13:19, EMT called time of death. So I'm not sure how much time had elapsed between the vaccination and the death, but we'll move on here. 91-year-old male. Patient developed hypoxia on 1/4/2021 and did not respond to maximal treatment and passed away on 1/5/2020. Vaccinated on 12/28. Next, we have 77-year-old male. Patient declined on 12/30. Keep in mind that the vax date was 12/28. Patient declined on 12/30 and was transferred to hospital where he did not respond to treatment and passed away 1/4. Next, the 65-year-old male. Patient did not report any signs or symptoms of adverse reaction to vaccines. Patient suffered from several comorbidities, diabetes and renal insufficiency. Patient reported not feeling well 1/6/2021 and passed away that day. Next, we have a 93-year-old male. Had a vaccination on 12/31/2020 late morning, passed away early morning 1/1, so the next day, less than a day. This is a 93-year-old with significant heart issues, EF of 20% among other comorbidities. He died suddenly approximately at 4:30. It is unlikely it was related to receiving the vaccine. That's their opinion. Next, 74-year-old male says patient was vaccinated at 11 a.m. and was found at the facility in his room, deceased at approximately 3:00 p.m. Nurse did not have cause of death. Next, an 87-year-old female patient. No adverse effects noted after vaccination, which was on 12/28. Patient with cardiac history was found unresponsive at 4:45 p.m. on 1/6/2021. Abnormal breathing patterns, eyes partially closed. SpO2 was 41%, pulseless, with no cardiac sounds upon osculation. CPR and pulse was regained and patient was breathing. Patient sent to hospital ER where she remained in an unstable condition, had multiple cardiac arrests and severe bradycardia, and in the end, the hospital was unable to bring her back. Next, an 85-year-old male. Vomiting later on 1/5, so he got the vax on 1/5, vomited later that day. Lethargy and hypoxia in PM of 1/6, hypertension in the AM of 1/7, hospitalized, intubated, cardiac arrest, died on 1/7. All right, the next fatality, 72-year-old female resident passed away in her sleep. It doesn't say the date, but she was vaxxed on 1/5. Next, 56-year-old female patient had been diagnosed with COVID-19 on December 11th, 2020. Symptoms were thought to have started on 12/5, 2020. Received Moderna vaccine on 12/23. Unexpected death on 1/8. Resuscitation attempts unsuccessful. This is a 76-year-old male. At 3 p.m., lung sounds, diminished oxygen saturation 68%, oxygen applied, oxygen sats remained low for next 36 hours. Patient on hospice care expired on 6:22 a.m. 1/8. So got the vax on 1/6, died on 1/8. Next, it says the patient was found deceased at home about 24 hours after immunization. Date of death 12/29. Estimated time of death 6 p.m. So the day after this 45-year-old male got the shot on 12/28, he died on 12/29 in the late evening. Next, we have an 86-year-old male patient. Received vaccine on 1/4. He was in hospice for CHF and renal failure, but was able to get up in his wheelchair and eat and take medications and talk. On 1/5 a.m., he was noted to be very lethargic and could only mumble, could not swallow, no localizing neurologic findings. He was too lethargic to get up in chair, and it fails to mention he died. Next, it says, this is somebody else. This is a 66-year-old male. Okay, so it accidentally started over again. It repeated itself, but I figured out what happened. I think I had too many deaths in the slideshow here, so I had to remove some, and it looks better. So let's keep rolling here. This is the next one. Notified today that he passed away. No other details known at this time for a 60-year-old male patient. Next, we have patient received first dose of vaccine on 12/28. Developed COVID-19 infection shortly thereafter. Expired on 1/6/2021. This looks almost identical to the last one. 77-year-old male. Patient received first dose of vaccine on 12/28. Developed COVID-19 infection shortly thereafter and expired on 1/4. Next, we have unknown aged female. Cardiac event 2 days after vaccination, patient expired. 2 days after with a cardiac event. Fever, shortness of breath for this 82-year-old female patient, and chest pain that resulted in a heart attack a few hours after vaccination. This one says medical doctor state patient has an acute cardiac attack, 86-year-old male. This just says death. This is a 52-year-old female. Patient received COVID vaccination around 12:15 p.m. Patient was monitored for the appropriate amount of time by nursing staff. Patient passed away at 2:15 p.m. 52-year-old female. Hours after the vaccine, it looks like. Next is a 73-year-old male. Diarrhea followed by death 24 hours after vaccination. It says here, on 1/7 received second dose of Pfizer COVID-19 vaccine on 1/8. Fever, dizziness, headache on 1/10 at 2:50 in the morning. Was found not breathing. EMS performed CPR and patient deceased. Next, received COVID vaccine 1/8. Expired unexpectedly 2 days later on 1/10. No adverse reactions noted, it says somehow. Female 70-year-old. Next up, a 61-year-old male patient had an apparent cardiac arrest on 12/23 and was admitted to the ICU. He was taken off of life support on 12/30/2020. He had known cardiac disease. This one says patient died. I have a copy of his vaccination card. 60-year-old male patient. This one, died a day after the vaccination. Pronounced dead 1/9/2021 at 12:42. Received first dose of vaccine on 1/8/2021. 43-year-old male. Day after. This one's a more lengthy one. 54-year-old female. Staff member checked in on her at 3 a.m. and patient stated that she felt like she couldn't breathe. 911 was called and taken to the hospital. While in the ambulance, patient coded. Patient was given CPR and brought back. Once at the hospital, patient was placed on a ventilator and efforts were made to contact the guardian for end-of-life decisions. 2 EEGs were given to determine that patient had no brain activity. Guardian made the decision to end all life-saving measures. Patient was taken off the ventilator on 1/9 and passed away. This is a day after the shot, and passed away 1:30 a.m. on 1/10. The initial indication from the ICU doctor was that the patient had a mucus plug that she couldn't clear. This one says, on 1/2/2021 at 10:30 p.m., complained right arm back hurt, took Tylenol. On 1/3, complained right arm hurt, dizzy. On 1/4, felt better, did laundry. Daughter found her deceased at 3:30 p.m. Doctor at hospital said it was cardiac event, according to death certificate. 91-year-old female. Took the shot on 1/2, had side effects, died on 1/4. This one says, staff reported that patient was found Friday morning, January 8th, sitting at a table with his head tilted forward and unresponsive to verbal or physical stimuli. Staff lowered patient to floor and started CPR. EMS was called and continued CPR at scene. However, they were not able to revive patient. Patient was pronounced dead at the scene. Staff written statements following the death of patient show that he had a fall about 1 hour prior. It is unknown if this fall contributed to patient's death. An autopsy has been requested. 68-year-old male. This one just says acute anterior MI with death. 99-year-old female. This one's a little longer. 92-year-old male. The resident resides in an independent living facility apartment. The reporter at the center was informed by his daughter he was not feeling well on 1/1/2021. Specific symptoms could not be ascertained. He reportedly went to be COVID tested on 1/1/2020 and observed to be deceased in his apartment on 1/2/2020. I do not have confirmation of his COVID results, although the reporter indicates his daughter reports his tests were positive. 82-year-old female patient went to bed at around 11 p.m. on Saturday, and sometime between then and 1:30 a.m. on Sunday morning, she got up and went into the living room without waking up her husband. At 1:30 a.m., the husband got up to use the restroom, and she was out of bed then, but her husband did not know if she was having any problems at this time. When he got up at 7:45, she was in the recliner and did not move or anything, which is normal for her. At 8:45 a.m., the husband went back into the living room and tried to wake his wife, and that is when he noticed there was no pulse, and he called 911 at this time. EMS got on scene and did CPR for 30 minutes, and she was pronounced dead at 9:21. Resident died, says the next one, suddenly and expectantly. I guess that means like quickly. Resident died suddenly and expectantly on 1/5, 2 days after the vax on 1/3. It's an 89-year-old female patient. Next is a 68-year-old female who's deceased. Patient received COVID-19 Moderna vaccine from the health department on afternoon of January 8th, 2021, and went to sleep approximately at 11 p.m. that night. Was found unresponsive in bed the following morning and pronounced dead at 13:36 on January the 9th. This one's a long one. Just says death, semicolon. This is a spontaneous report from a contractable a contactable physician. An elderly male patient received the BioNTech Pfizer vaccine via an unspecified route of administration on an unspecified date, although down here it says 12/1, but that's probably not right. The single dose for COVID-19 immunization. The patient's medical history and medication was not reported. The patient died in January 2021. This person, it says COVID-19, pneumonia, respiratory failure. 80-year-old female patient received BioNTech Pfizer COVID-19 vaccine. Medical history included Alzheimer's, no known allergies. This one's a long one. So she got the vaccine on 1/2. On January 4th, she developed a high fever, needed oxygen, and was positive for COVID-19. Date of death was January the 4th. So 2 days after the shot. Next one, another death, this time a 54-year-old male patient. It says mind just seemed like it was racing. Body was hyper-dried. Restless, not feeling well. Agitated, vomiting, trouble in breathing. Pfizer BioNTech vaccine. Vaxxed on 1/4. The patient experienced not feeling well, ate a bit but not much, kind of pale, vomiting, trouble in breathing, and agitated on January the 4th. Body was hyper-dried and restless on January the 5th. Mind just seemed like it was racing on January 6th, and not responsive, and he passed on January 6th. That's 2 days after the vaccine. This one just says, patient was reported to be deceased at home by law enforcement on 1/7/2021, 73-year-old male patient. This one says, there were no adverse reactions. Resident died. Let me start again. There were no adverse reactions. Resident died. She had a history of issues with her health prior to the vaccine. So no side effects except for the death. Patient was found unresponsive at home with SpO2 20% 1/2, just really 2 days right after the vax date of 12/31. This one, 56-year-old female. Patient received the first dose of Moderna and was found deceased in her home the next day. It says, my mother was given Pfizer vaccine on Thursday and she died 3 days later yesterday on Sunday, ! 85-year-old female patient. Difficulty breathing, death. 63-year-old male vaccinated on 1/5. This one's a 98-year-old female. Resident first dose of Moderna vaccine administered on 1/4 at 8:30 p.m. Resident found unresponsive on 1/5/2021. So a day after. This is an 89-year-old male patient. Loss of consciousness. Patient received COVID-19 vaccine dose 1 on 1/6 without complications. For the next 3 days, patient did not experience any injection site reactions, denied pain or tenderness at injection site, no dizziness, no NV, remained afebrile. Around 1/9 at 6:10 p.m., patient became acutely non-responsive after being helped to the edge of bed. Per nurses, he was previously awake, alert, talking, and asymptomatic. Patient is a do not resuscitate, but facility rapid response emergency team called DT patient sudden change of condition. Emergency team helped patient into lying position. Resident passed at 6:20 p.m. So it's 3 days after the shot. This is a 25-year-old male patient. Patient received the vaccine on 12/22 without complication. It was reported today that the patient was found unresponsive and subsequently expired at home on 1/11. This is a 91-year-old male. The facility had positive cases of COVID when we were able to begin vaccinating residents. Within about a week of vaccination, patient was tested positive for COVID. He was 90 years old, and his immune system did not have the time to allow the vaccine to begin working before exposure. His age was a major contributing factor to his death, it says. Within a week of vaccination, just to highlight that. Here's a 91 female. The facility had positive cases for COVID-19 when the vaccine was received and administered to patient. With her advanced age and chronic conditions, she did not have time to build immunity between the time of vaccination and her testing positive. This one says the facility had a number of positive COVID-19 cases prior to patient's vaccination. Due to her advanced age, chronic condition, and exposure, patient did not have the time to build immunity after exposure before becoming positive. So they're blaming COVID for this one. Here's a 70-year-old male. It says patient expired due to possible cardiac arrest. Possible cardiac arrest. Unsure if this was vaccine related. It says we don't have the death date, but it must be recent, right? Because it's 1/23 right now. The person was vaxxed on 1/7. It's in the system, which is usually a couple weeks behind. So I would imagine that's pretty quickly after he got the shot. Here's somebody, 86-year-old female, vaxxed on 1/11. It says resident was found deceased at approximately 6 p.m. in her apartment. Deceased in her apartment, it says. This one is a 44-year-old female. It says unsure if related to vaccine, but was notified by her next of kin that she died on 1/4. No reports of side effects or hospitalization were reported to the facility prior to the notification of death. So, vaxxed on 12/23, died on 1/4. Here we have another reported death. 62-year-old male. It says patient reported expired on 1/7. The vax was on 1/2. Here we have an 85-year-old male. It says patient was sent to the emergency department due to significant hematuria. He was afebrile. And he died apparently too. This is unknown gender, unknown age. Died, it says. Pfizer BioNTech vaccine. So it sounds strange because there's not much known about this reported patient here, but it says it was reported the patient was a doctor, died after the vaccine with no apparent disease. It was not reported if an autopsy was performed. No follow-up attempts are possible. Information about lot batch number cannot be obtained. Unknown cause of death. Here's another one, 51-year-old female. On 1/8 at 5:30 p.m., patient taken to ER, cerebral hemorrhage, stroke, aneurysm, and death, right? 3 days after the shot. Here's a longer one. Male, 88 years old, vaxxed on 1/6. On 1/7, resident had decreased appetite noted in AM, but ate 100% of meal at dinner. On 1/9, resident had decreased appetite with emesis ×2, loose BM ×2, call placed to hospice. At 1:10, 5:44 a.m., resident able to take HS meds, ingest 2 cups of shake, no emesis or loose stool noted. At 12 p.m., nurse noted resident not eating meals but ingesting milkshake and medications without any problems. Hospice contacted for change in condition. At 1 p.m., hospice ordered phenergen, 12 milligrams, labs to be drawn at 1:11. Hospice notified POA at 1:11 or on 1:11 at 12:24 a.m. Resident had blood in stool. Resident denies any pain. Apparently they died too. I'm not sure at what point they died, but they're marked in the system as having died. Next, we have patient vaccinated on 12/28. Approximately 1 day later, develops cough and an azithromycin times 1 week. On 1/3, patient develops left side weakness and aphasia, taken to the hospital, tested COVID positive, required intubation, acute hypoxic respiratory failure secondary to COVID on H&P. Patient died on 1/4 at 7:20 a.m. That's a 32-year-old female. So about a week after the shot. Next, we have a male, 48 years old, sudden cardiac death, it says. Received the vaccine December 22nd. Here's the next one. 88-year-old male, it says 3 hours after receiving COVID-19 vaccination, patient oxygen level decreased to a critical level and went into cardiac arrest. Staff performed full code, but was unable to bring back patient from cardiac arrest. 3 hours after the vaccine. Here's an 83-year-old male. It says, patient received vaccine on 1/8. On 1/9, I checked on patient via phone for symptoms or problems, and he reported none but mild soreness at injection site. On 1/10, family friend called me to tell me that patient had expired at approximately 8 p.m. Patient reportedly complained of pain, unspecified or unspecific, and collapsed at home. Hospital reportedly told family that it appeared to be a heart attack. This is a long report here. 81-year-old male. Patient passed away after receiving the COVID vaccine. 81, we already said that. The Pfizer-BioNTech vaccine into the right arm on January the 7th. On January 8th, the patient passed away after receiving the COVID vaccine. Wow, the next day, they died. So we don't have time to read all of that, but you can pause it if you want. Patient received her vaccination on 1/12, administered by pharmacy. She expired on 1/12, so the same day, later that evening. Resident did not have any adverse reactions and was a hospice patient. I don't know why they keep saying that. They died. Isn't that an adverse reaction? No adverse reactions at all, just died. Okay, next we have patient was found acting abnormal on 1/9. So the shot was on 1/7. Acting abnormal on 1/9 at 12:15. EMS activated. They arrived and patient was found pulseless, transported to the medical center, unsuccessful resuscitation, and expired on 1/9, 2 days after the shot. 75-year-old male patient. Another long one here. It says unknown age and gender. Pfizer-BioNTech vaccine. Doesn't look like we know much about it, but they apparently died. That's one thing we do know. Here's another one. Female, 82 years old. Heart attack. This is a spontaneous report. Pfizer-BioNTech COVID vaccine. It says, took the shot on 1/5. Same day, the patient experienced a heart attack, which resulted in death and was assessed as medically significant. I would say I would agree. Although I'm not a medical professional, disclaimer. The patient also experienced the associated symptoms of cold sweats, chest pain, shortness of breath. All right, let's keep rolling here. Next one, 66-year-old female, cardiac arrest. Patient was found pulseless and breathless 20 minutes following the vaccine administration. 20 minutes after, pulseless and breathless. It says, contributory role of BNT162b2 vaccine to the onset of reported events cannot be completely excluded. Well, that's one way to put it. Okay, here's a 90-year-old female in this report. Actual event and cause of death were unknown. Pfizer-BioNTech vaccine. She was talking, the patient, or excuse me, the consumer stated that she was taking the reporting responsibilities to report that a friend of hers informed that the patient passed away on Friday and had received the COVID vaccine on Wednesday, so 2 days after. So it looks like all we know. Male, 91 years in this one. Staff walked into resident's room at 10 a.m. and noted resident's left side of his face was flaccid. Nurse was called, and upon assessment, resident noted to have an unequal hand grasp with left worse. He was able to talk, but was mumbled and hard to understand. Physician, hospice, and family were notified. Resident had a stroke at 10 a.m. on 1/8. That's the day after the vaccine. He lost all ability to use his left side. All ability to use his left side. Well, I wonder what side he got his shot on. Resident passed away on 1/11. Here's the next report. 83-year-old female passed away today on 1/13, the day after she got the vaccine on 1/12. It says she was a hospice patient. She showed no adverse effects after receiving the vaccine on 1/12. This morning she woke up as normal, and during her morning shower she had a bowel movement, went limp, and was non-responsive. The patient passed away at 7:45 a.m. Next, we have a 60-year-old female in this report. It says, this person was found to be deceased on routine rounds during the night at 3 a.m. No symptoms of reaction noted post-vaccine. No injection site reaction. No reports of any allergic reaction. So I'm not sure if that was the same day or if that was a couple days later. This is a 56-year-old female in this next report. It says, a resident began having fever on 1/11 at 6. I'm guessing 6 a.m., right? It says there's vitals, but I'm going to skip over those. At 3, it says resident's condition declined. At 3 p.m., resident started having respiratory distress and hypoxia. Condition worsened. Resident sent to nearest ER for evaluation. Later in the evening, the staff at medical center called to inform staff that resident had expired. So the vax was on 1/4, and then a week later, these issues popped up. These big issues that got worse and worse. Male, 78 years old, vaxxed on 1/13. It says, little bit of a reaction, lightheaded after 5 minutes. Vital were low, so observed for 30 minutes after being lightheaded. Patient was found unresponsive and pronounced dead later that day. Same day. Here's the next one. Actually, this might be a duplicate. Let me do some digging here. All right, now we're straightened up. So it says here, death occurred 3 days after vaccine receipt. This is the next report here. 87-year-old female, vaxxed on 1/2. Death occurred 3 days after vaccine receipt, attributed to complications of her chronic advanced dementia with aspiration at aged 87. No evidence of acute vaccine reaction. Next one, female, 62 years. It says, no adverse events from vaccination seen on 1/2. That's the date of the vax. On 1/6, resident was seen by doctor. And it goes over some of the medication, which I'm going to skip over. On 1/8, resident was shaking. Lower extremity is mottled. Oxygen increased. Just skimming over this. All over pain reported. At 8:50, when they attempted to reposition the resident, she was not responsive. No heartbeat heard or pulse found. So 6 days after the shot. Next, we have a 54-year-old male. 54, or I already said that. So I guess he's an alcoholic. Is that what this means here? Alcoholic cirrhosis? Is that a disorder? Cardiac arrest, it says. having constant diffuse abdominal pain that radiated to his chest for a day. On scene, the patient had a witnessed arrest with EMS starting CPR. He was given 3 rounds of epi without ROSC. Patient had no associated shockable rhythm. Of note, patient's wife had noted patient had received COVID vaccine the prior day. So one day after. So the next one here, 89-year-old female. Vax first dose received on 1/4. 2 days later on 1/6, resident had shortness of breath, increased weakness with O2 sats at 91%. On 8th, that's 4 days after the shot, resident sustained a fall, dizziness, weakness, negative COVID results. On that evening of the 8th, resident was lethargic and diaphoretic with fever of 99.9. Resident transferred to ER on oxygen. Resident returned from ER on 1/9 with new diagnosis of leukemia and orders for hospice. Continued with fever, crackles, and N/V, and loss of appetite from the 9th and 10th of January. Resident expired at 8/20 on 1/11, 1 week after the shot. Next, we have 88-year-old female. It says, initial pain in back of head and extreme headache, some vomiting. At emergency, went into coma and was intubated. Hole drilled in skull to relieve pressure. Ouch. MRI taken. A lot of bleeding in brain. Aneurysm led to death approximately 14 hours after initial symptoms. Vax received on 1/12. Next, we have a 73-year-old female patient who collapsed at home approximately 5:30 p.m. and died. Collapsed. So on this report, 28-year-old male on day due for second dose, patient was found unresponsive at work in the hospital. He was at work. 28-year-old male. Patient pupils were fixed and dilated. Full ACLS was initiated for 55 minutes with multiple rounds of bicarb, calcium chloride, magnesium, and epinephrine. Patient was intubated. Patient continued into VFib arrest and was shocked multiple times. Wow. 68-year-old male, systemic. Reported by staff, patient expired under suspicious circumstances after receiving vaccine. Patient was on hospice. Reported not expected to pass this soon. Symptoms lasted 0 days. It's a weird way to put it. Here's the next one. Male, 75 years old. It says, no adverse reactions observed after administration of medication. I'm presuming they're talking about the vaccine. Patient started complaining of shortness of breath around 5 the following morning, 5 a.m. SpO2 checked in the 80s. Patient expired on 1/9/2021, the next day after the shot, by the way. This person, 65-year-old male, died 2 days after the vaccine, it says. Had a 101-degree fever on day of booster shot. Received the vax on 1/9. Just going to skip through a little bit here. Okay, it's very verbose, but I think we got the gist. Another long one here. 70-year-old male, coded on January 9th, took the vax on 1/5. It's the Pfizer BioNTech shot. "76-year-old male," it says, resident expired on 12/30. Diagnosed as a cardiac arrest. That's after the vaccine on 12/26. So 4 days later, they died. Here's the next one. Female, 62 years old. Resident expired on 1/2 after the shot on 12/26. Here's a male, 56 years old. took the shot on 112. It says, cardiac arrest within 1 hour. Patient had the second vaccine approximately 2 p.m. on Tuesday, January 12th. He works at the extended care community and was in good health that morning with no complaints. He waited 10 to 15 minutes at the vaccine admin site, and then told them he felt fine and was ready to get back to work. He then was found unresponsive at 3 p.m. within an hour of the second vaccine. EMS called, immediately worked on him 30 minutes in field, then 30 minutes at ER, was able to put him on life support, yet deemed brain dead 1:14 and pronounced dead an hour or so later. Wow. So he had the second shot at 2 p.m. Unresponsive, he was found at 3 p.m. And I guess they worked on him, but he was deemed brain dead by 2 days later on 1/14. This person, it says, 83-year-old female, patient died on 1/21/2021 after the shot on 1/12, so 9 days after. This one says, patient died, a friend called to let us know, 83-year-old female. This one, 92-year-old male, it says, resident found unresponsive and without pulse at 5:45 a.m. Not sure the day, though, in relation to the shot. So this person was given a shot, this 88-year-old female, vax date 1/4. On 1/11, noted with headache, nausea, vomiting, severe malaise. On 1/12, resident expired. 71-year-old female who took a shot on 1/13. On 1/14, VS taken at 10 a.m. That goes over the vitals. Patients showed no signs of distress. At 11:50, a nurse went to perform a COVID test and assessment and found the patient unresponsive on the bathroom floor. CPR was immediately started. No shock advised per AED. And then death was declared. So what happened here? The next day, she was found unresponsive on the bathroom floor. After the shot, that is. So this is a 96-year-old female in this next report. Has underlying dementia and often with difficulty eating. 1 week after immunization, she developed a stroke with left side weakness and difficulty swallowing. Comfort measures instituted. Not sure if this is related to the vaccine, but thought I should report. I'm glad they did. How many people are just so cocksure it had nothing to do with the vaccine, they never report it? And I'd also like to know, what side was she stabbed on? What side did she get the injection on? Because if it's her left side and she has the left side weakness, that would be different than if she was injected on the right. Here's an 83-year-old female resident, vaxxed on 1/13 with the Pfizer BioNTech shot. The next day on 1/14, the patient reportedly got up in the middle of the night feeling blah, restlessness, and nausea. At 4:15 a.m., the patient was asked to go back to bed, assisted by a nurse and GNA. At 6 a.m., GNA was going to do morning VS and found the patient unresponsive, no pulse, no respirations. GNA notified the nurse at 6:03, CPR started and EMS called. At 6:30, EMT called time of death. That was the day after the shot. Early morning the day after. Here's a 72-year-old female in this report, vax on 1/2. It says no reactions immediately after vaccine was given. Resident has dementia, has had multiple hospitalizations related to a renal stone recently, had a tooth that was bothering her, went to see her dentist, and it was extracted on 1/6. On 1/10, they noted feet and ankles are dark purple with white splotches appearing to be mottling. minimally responsive to voice and touch, not eating, compassionate visit with family. Family did not want hospice, did not feel it was needed, said, what more could they do for her than you're already doing? On 1/11 at 7:50 p.m., she was declared deceased. So that's 9 days after the shot. Here's a 94-year-old male in this report. Had no immediate issues with the vaccine. He had returned from the hospital on 12/21 and had some concerns about his weight, which were shared with his physician on 1/4. On 1/5, had a visit with his cardiologist for a pacemaker check. On 1/8, staff were called to his room. He was on the floor, bluish skin color, no vital signs found, no heart rhythm. So he died. That was 6 days after the shot. This person died 3 days after receiving the vaccine. The doctor chalked it up as pneumonia. Pfizer-BioNTech vaccine. The shot was on 1/7. 3 days later, the patient died on January 10th. All right. The next one is 70-year-old female in this report, vaccinated on 1/14 at approximately 10:30 p.m. on 1/14/2021. Resident was noted to have a rash on her face, hands, arms, and chest. So that was the same day as the vaccine. It goes over the treatment. At approximately 2 a.m. on 1/15, resident congested and coughing. At approximately 2:30 a.m., they gave some cough syrup. Resident's condition began to worsen with breathing TX. This LPN updated at 2:48 doctor on resident's condition. Doctor gave permission for resident to go to hospital. At 4:19, the ER called to say resident passed away. So that's like the day after the morning after the shot, it looks like. I believe this is the last. Yep, this is the last of the 148 death records in the VAERS database. So we're going to end after this one. A 51-year-old male with HO02 dependent COPD, severe pulmonary fibrosis, became increasingly hypoxic around 6 p.m. on 1/7. That's the same day as the vax. He was transported to hospital for acute on-chronic hypoxia respiratory failure. On 1/12, he decompensated further, and after discussing with family and palliative care, he was changed to comfort care. He expired on 1/12 at medical center. That's 5 days after the vaccine. So again, that's the VAERS data straight off of their website, vaers.hhs.gov. I just want to give people all the information possible. Remember, not all of those were definitely 100% caused by the vaccines, and also not all adverse events are actually reported into that system. So I think both of those are fair disclaimers. If you like this work, if you think it's an important thing for somebody to be doing this, going through all the data, making graphics, sharing these people's stories so that we can learn from them, learn lessons from what happened, then consider signing up for GroupDiscover for a number of reasons. One is it helps you find great content, which can be very hard to do these days on the internet, which is, so rigged it's not even funny. And it also supports the show, and it supports this research, and it allows me to make more and more videos like this that you can share with people. And on videos like this, please feel free to download them and upload them on your channels. I think this is super important, and I'm going to be doing more reports where we go through the VAERS data, other news stories that are breaking, Facebook posts, Twitter posts of people encountering issues or anything like that that you should know. And I really appreciate whenever anybody shares the videos. I super appreciate when somebody signs up for GroupDiscover. And thank you to the people who already have. If you don't know, GroupDiscover is just an easy way that we can share videos. You just click new video, you paste the URL in there, and everybody can see all the videos that people are sharing. And then we have a searchable archive here where we can search for things like vaccine and find, the top-rated vaccine results this week, this month, past 3 months, etc. There's various ways to filter down the results. And it gives you suggestions based on what you haven't seen yet that are the highest rated in the system. For every video, you can rate 1 through 5 stars. And everybody's ratings determine what are the best videos. And it knows what you have or haven't seen yet, so it won't show you, it won't just keep bugging you with the video you've already seen. So I made this whole thing from scratch to serve an underserved community, ours. And this will allow us to break through the barriers of tech censorship and circumvent the rigged YouTube algorithm. So check that site out. I'm going to have more reports like this. I spent a lot of time building a script and all that kind of stuff, doing a lot of database work so we can download the CSV files off of VAERS, generate these graphics for various things. Like today it was deaths, but we could also do other types of adverse events that we've been seeing, such as numbness or headaches or anything like that. And every day more data is every week really is a better way to say it. On Friday, they release the new set of VAERS data. So up until yesterday, Friday, they had 6,700 adverse events in the database. Now it's up to 7,700 after the new batch of data. So I'm going to be staying on top of this. If you want to support the work, GroupDiscover.com is the best way to do it. Share the video. Also download the video. Upload it onto your own channel if you know how to do that. And let's really get this information out there. Many more reports to come, so stay tuned for those. And I appreciate everybody, especially the people who help support this channel through these trying times. Have a great day, everybody. And I need to add this in. My condolences and well wishes go out to everybody, really, but especially to the family members who lost a loved one. Especially any of the people that we just covered there. That's super sad whenever we lose a light amongst us and another soul leaves the body and we lose a fellow human. It's really sad, and I'm going to keep covering this. I hope I don't get censored on YouTube, but whatever. I've got to let the data get out there and fall as it may. I hope you all have a great day. Keep seeking that truth and sharing it, and I really appreciate you.